Fever is the abnormal rise in body temperature. Usually, it's a type of immune response to viruses and bacteria. But our question today, what is the best way to measure my child's temperature? In the beginning, let's know the types of thermometers. The first type is mercury thermometer. Its use is almost stopped due to the risk of mercury in our body if the thermometer is broken. The second type is the digital thermometer, and it's the most accurate. The third type is the infrared thermometer, and as you can see, there are two types of infrared thermometer, one for the ear and one for the forehead. The last type is the mobile phone, which I don't recommend to be used. But still, we didn't get the answer. Which one should we use? For children from 0 age until 6 months, digital thermometers are preferred. Of course, not in the mouth, not under the armpit, but rectally. And make sure to use some lubricants to prevent any injury to that area. For children older than 6 months, infrared thermometers are preferred. And I recommend the ear type more than the forehead type because any change in the blood flow to the head or sweating in the forehead may give wrong reading. But also, what we need to know about using the ear type is that it measures the amount of heat produced by the tympanic membrane, meaning it must be directed to the tympanic membrane in order to give accurate reading. If we look at the ear from outside, we'll find that tympanic membrane is not shown, like what we see in this image. So the correct way to use the ear type thermometer is after placing it at the opening of the ear and before pressing the measuring button, you must pull the ear backward, like what you see in this image. Okay, let's answer some related questions. When can we use the digital thermometers orally? Once the child is 4 to 5 years of age and cooperative, then oral digital thermometers can be used. Should I use the reading as it is, or should I increase to it or subtract from it? Rectal reading should be considered without any change. This is also applicable to ear measurement. Oral reading must be increased by 0.5 degrees Celsius because it's affected by breathing and sometimes the liquids taken by the child. Under armpit reading must be increased by 1 degree Celsius, but I don't advise using armpit measurement because sometimes it's lesser than the body temperature by more than 1 degree and thus you will get wrong reading. In conclusion, between 0 age and 6 months, use rectal digital thermometer, and above 6 months, use ear infrared thermometer and make sure to use it correctly. Okay, fine. Let's talk about units. Some thermometers measure Celsius and some Fahrenheit. How can we convert the reading? It's so simple. From Fahrenheit to Celsius, subtract 32, multiply by 5, then divide by 9. And do the opposite. From Celsius to Fahrenheit, multiply by 9, divide by 5, and add 32. If you forget the formula, Google is always there. Okay, now we know which thermometer to use and how to convert the units. The last important information you have to know is what's the normal temperature. Usually it's 36 to 37.5 and it differs from child to another. But when should you consider the temperature as fever? Now 37.8 and above is considered as fever and 37.7 and less is considered as normal temperature and of course not to go below 35. If you like the content of this episode, don't forget to subscribe in this channel not to miss any new video which may enrich your knowledge. Also, if you have any questions, leave it in the comments. Stay you and your children safe.